The situation has become critical. The number of cases is rising. If we don't want our hospitals to be submerged, if we want to limit the number of deaths, we must act strongly right now. I'm announcing that the region of Montreal, the Capitale Nationale, and the region of Chaudière-Appalaches are switching to red alert. The following rules will apply from October 1st to 28th in these three regions. First, only people living at the same address can be inside a home at the same time. But there will be exception for people having to receive one person from another address. But the general rule is we must stay at our address. Also, the red zones, in the red zones, bars, dining rooms and restaurants will be closed starting October 1st. Theaters, cinema, and other gathering places will also be closed, and we're working on measures to compensate the owners. In the red zones, places of worship will be open for a maximum of 25 people at a time. Outside, everyone must apply the 2 meters distancing rule. Our goal is to protect our health system, our schools, and the work of as many workers as possible. Businesses can stay open in red zones if they respect the public health rules. We're announcing new measures for the red zones, but we also need to reduce our contacts everywhere in Quebec. We cannot wait for the red alert to act. We give ourselves 4 weeks with these measures to see if we can stop the second wave. I truly hope we do, but I cannot and will not make false promises.
If you don't announce further measures of how you're going to enforce this at home, are you confident just asking people to not have gatherings will be enough?
Yeah, well, first, as we said for many weeks, that we prefer not to enter the house, and because without a mandate, we cannot do that. So we've been very clear. Our Vice Prime Minister, Geneviève Guilbeault, is looking at every measure that we can take, but she's looking at that right now to see how can we enforce the full respect of those new measures of not having any party at home.
Thank you.
We had the numbers down. We had months to prepare for a second wave. Now we're back up to 750 new cases a day, and we're shutting down huge parts of the economy again. You're the premier, you're in charge. Did you drop the ball on this?
No, I think that hospitals are still under control, deaths are still low, but we have to take these decisions today if we don't want that it happen in the next weeks. So right now we've seen the number of cases increasing more than only in the Great Montreal. It's also in Quebec City, in Chaudière-Appalaches. We see that our hospitals are in a fragile situation today, so it's time to take action. And I hope that in a month from now, we'll be able to reopen. It's a question of balance. I understand that people, they have to come back to a more normal life, but we have to do that gradually, and we have to manage the number of cases. But today, it's the time to take additional measures.
But with respect, what happened? Why did it get bad again like this?
Because some people, they enjoy the summer, they enjoy having fun together. You've seen, like me, some images, pictures of some people at the Tam Tam place in Montreal. Unfortunately, we have to tell the people the situation is now critical. So we have to come back, not as far as where we went last spring, but to put additional measures. That's where we stand, and we have to do that right now.
What I want to know is, we knew this was maybe coming, but why now? Because we're still under that 5% threshold for the number of tests that turn positive, and the hospitals are not really crowded yet with COVID cases. So I just want to know why did you decide today, this
But,
week?
First, like you say, we're at 5%. So about a month ago, we were at 1%. So it's a lot more. In some hospitals in the Great Montreal, in Quebec City, in Lévis, the situation is getting fragile. So, and we think that we have to stop this increase in the number of cases, because it will have an impact after on the number of people in our hospitals, and right now the situation is at the limit.
Okay. Do you think it's going to be hard to get people to kind of cooperate and follow the rules this time around?
But of course, in closing bars and restaurants, it's quite serious, so people won't have the choice to go or not in restaurants and bars. But I'm asking the population, please don't do that for you, but do that for vulnerable people, for our young people. We're now having every day more and more classrooms that have to close, and we want to keep our children in our schools. So please do that for them.
When you announced the measures in the springtime, which were much more strict than this, we only had about 220 daily cases. Now we're very much more than that. Is this going to be enough to stop the spread, given that it's so much less than what we did in the spring?
I think the situation is different than in the spring. First, we don't have that many people infected in our CHSLD. Also, the trend, we knew at the spring that we would go to 1,000 cases, new cases a day, quite fast. Right now, I think that if we do that correctly, we can stop the increase. So the situation, I think, is different in many ways of the spring situation.
I think the power of the control of this epidemic is not anymore on our hands, it's on your hands. So you can contribute by the way you behave in this society, by distanciation, mask coverage, and hygiene. That's gonna be the power that we can have. If all we do that, don't wait for your neighbor to do that at your place. It's on your hands. It could be your life, your family one's loves, or even not dying from COVID-19, but having no more access to the hospital, to the care that we need.